Since 1981, when the AIDS epidemic began, 30 million people have died worldwide as a result of the illness. If this drug is approved, lives could be about to change. Truvada is currently used as part of a cocktail of drugs to treat patients who already have HIV. But its use could be dramatically expanded to include healthy people who are at risk. Dr. Robert Grant led the groundbreaking research.
I think this is a huge milestone. I think that we are in an era now for the first time when we can foresee the end of the AIDS epidemic.
In his study, more than 1,200 healthy gay men took Truvada, and it reduced the risk of HIV infection by 44%. But many failed to take the drug faithfully. For those who did, the protection was much greater.
Among those who actually used the drug on a regular basis, the protection was much higher, over 90% reduction in the rate of HIV infections.
Scott Owens took part in the study. He's been taking Truvada for 4 years.
It's not a death sentence anymore like it was 20 years ago, and I'm hoping that if this drug comes out, that it would just add one more protection in their lives.
But not everyone's on board with the miracle drug, believing the FDA recommendation could undermine existing HIV prevention methods.
If someone thinks that they're protected from something, they're more likely to behave more riskily. So someone would not be likely to use condoms and take Truvada at the same time.
But Dr. Grant says condom use increased after patients began taking the medication.
We are hopeful that the prevention pill plus early treatment can decrease the rate of new infection to very low levels. Our goal is to get to a point where there is no new infections.
Yes. But problems, especially in Africa, remain. Ensuring people take the drug regularly, that they continue to practice safe sex, and that the cost of the drug isn't too high are just some of the issues that still have to be dealt with. Caroline James, Sky News.